occasions it does have more durations of operational stay, but it doesn't have more chances of death. Okay, thank you for listening. Thank you.
Our next speaker is also from the Sheikh Kyrgyzstan, and he is
I'm sorry, any
Osama
questions?
Abbas. His topic is assessment of academic stress in first year product students at a higher medical school.
Okay, thank you.
Can I start? Hello everyone, being Osama Abbas, I'm 30 years old student, and I'm here to present by the assessment of academic stress in first year foreign students at higher school of international. And we see that students demonstrate increased level of stress during their education. And university counting cells are also noted an increase in number of students seeking help in recent years. Now, academic stress is understood as a crisis, and its level can be different from each student. Each second of one student can contribute to this problem. It will, German student meaning there is social stress in their form that about 15 to 20% of the students who face impairment in their nervous system during their examination. In 2012, density was also stated that India has the highest suicide between ages of 15 and 29. And alarming is that these numbers do not have a number. So that's an effective preventive measures are needed to help students adapt to these new environment, help to prevent them from developing to depression. Because medical profession is very prestigious in South Asia and in India. So, especially for first year students, they have to figure out the fast paced and highly competitive environment. Just introduction. So, that's like a necessity to identify the any stresses, and that's what the purpose of our students. Could you go to previous slide? Yeah, that's what the purpose of a study is. First, to study the impact of adaptation to learning on students. Second, to identify profiling risk factors. And third, to propose a way to solve them. Next slide, please. Next slide, please. Yeah. So for our research, 126 first year medical student is between 19 years participated in our research on voluntary basis. And our questionnaire was consisted of four blocks. To enhance learning lies on the academic stresses regarding the academic factors. Second, regarding the environmental factors. Third, regarding related to other people. And fourth, the personal factors. And statistical transcription of these indicators were carried out according to each factors. And we assess the result in the data percentages. Next slide. Next slide. Yeah. Here you can see the picture of student participants. Next. Next slide, please. Yeah, so the result of the first academic or first one, regarding academic, show that the two main factors are to be considered. First, the exam pressure, and second, regarding their increased class. Other factors also included like lower grade, pressure of lower grade, some competition with fellow students, there could be some language difficulties, and maybe some lack of school support and uncertainty of getting jobs after the graduation. Could be some due to some medical resources like books. And the least considered factors in academic criteria was the low motivation. Next slide. The result of the next factor, environmental factors. So, two main factors to be considered in academic criteria was moving to a new city and lack of vocational trades. Because the student finds himself in new geographical conditions And he also should know that along with the academic stress, he also has to communicate with many people, in social context. And for that, he needs to adopt, mobilize and adopt the physiological indicators. And other factors to consider also were maybe some could be some dynamic conditions or some maybe divorce between parents, or could be if they are placed in some unfamiliar situation. Yeah, next slide. The third result of a third law related to other people shows that the main factors we can see the student are misunderstanding among 23.4% of the students. And about 19.2% students think that the strangers are the main stress factors while they move to the country for studies. Because along with their academic factors, we also need to communicate with people within the social context. And there could be a change in the relationship with others, could be some due to roommate conflict, could be some due to family problems, or fight with girlfriend or boyfriend, if you have any, As the next one is personal factor. The last factor to be considered was personal factor. And this is mainly explained by change in the sleeping habits, change in the eating habits, because the food in place of sleep is also different. So this factor is mainly explained by chromophysicological change. But other notable factors are also financial problems, some combined job studies, change in using network. But during our PhD study, we found that the student would have an student has support from their parents teacher and communication. And mostly first year students are not using alcohol and drugs. Moving on to our conclusion, so the result shows that the first year student showed high levels of academic for the primary grades. Academic stresses were represented by these indicate that they experience academic stress in a particular predictable manner. And the greatest source of evidence is found in taking and preparing for exam and competing for grades with fellow students. The assessment of academic stress factors focus on the study of environmental and triggers which were identified as insufficient education time and moving environment. The demands of the university life also spending a lot of time among fellow students and during social interaction. And for some, living together it can also be a source of attention. And particular attention is associated with the presence of obvious reasons for the student to organize their personal space and habitual lifestyle. Yeah, for preventive purposes, it is recommended to introduce a preparatory strategy to help students adapt to the new education environment and provide assistance to students. And, question?
Thank you so much, Shankar, Anil, Shahja, and Abbas. Thank you so much for joining us from Kyrgyzstan. We really appreciate your participation. You can continue joining us further if you want to see the further conference. For now, that it will announce winners at the last, so you can keep joining us. Thank you so much.
Thank you so much.
Now I would like to call two members from the scientific board, Priyanka Yadav and Kriti Khandelwal. They have research work on telesurgery, revolutionized medicine.
Good morning, respected jury members, respected teachers, and all my dear friends. Today we are going to present our research work on the topic telesurgery, revolutionized medicine. So I would like to invite my team member to give you a brief about telesurgery. Hello everyone, let's talk about telesurgery. Telesurgery or remote surgery is also known as master-slave surgery. It is the ability of surgeons to perform surgery even though they are not physically present in the same location. It is like a telepresence and it was explored in the 1970s by the NASA US. It was Let's talk about the robotic surgical system. There are so many robotic surgical systems like Navium surgical system, Mako surgical system, and so on. But the Zeus was the Predator one, and Da Vinci is the advanced one with 3D visualization and more accuracy. Let's talk about little deeper of Zeus and Da Vinci. Zeus was manufactured for the minimum invasive procedure, high precision, and fast recovery. With the help of the Zeus, we've done our first successful telesurgery, which is also known as liver operation. Let's talk about another one, which is Davinci. Davinci is the advanced one, and we use this for the wide range of surgery because it has 3D visualization, and its 3D visualization gives us clear and detailed view at the surgical site. So I'm going to make you familiar with the two important clinical cases of the telesurgery. The first was the first successful clinical operation, which is also known as the Lindeberg operation. This operation was performed on 7th of January 2001 on the female patient who was 68 years old. This was merely a 45-minute of polycystic operation, which was performed on the female. The female was admitted in the hospital in France, and the surgeons were controlling the robotic hands from New York. So there were a lot more distance. Until 2001, all the telerobotic surgeons used to believe that there is a limit of 500 kilometers only between these such type of procedures. But after the surgery in the France, they overcame this limit. So my another clinical case is from China. In 2019, there was a surgery which was performed on 12 different patients from 6 different cities and 6 different hospitals in China. This hospital was performed on the 6 females and 5 males. They were having a spinal disorder. Few of them were having thoracolumbar sclerosis and lumbar sclerosis and fractures. They were inserted the 29 pedicle screws in them, and the conclusion of the surgery was that there were no side effects after the surgery and they got relief from their acquired symptoms. So we came to know about the importance of the telesurgery. Apart from these, there are several types of advantages in telesurgery. For example, the most important advantage is that it provides a 3D visualization, which enables the surgeon to have accuracy and precision in the surgeries. For example, surgeon hands are unable to get to the pelvic region, so these robotic hands give us a more precision in the surgery. Moreover, the advancement in the telecommunication and robotic surgery had made telesurgery a feasible option for the patients to get access to the medical care without traveling so much. And this telesurgery has also been provide the medical care to the regions where there is no access to medical care. For example, in the battlefield and spacecraft. We all know that they calls for all the things. So apart from the advantages, there are some loopholes that need to be fixed in the telesurgery. For example, the greatest loophole in the telesurgery is that firstly, there is no 5G network available in the rural areas, so we can't perform the surgery. Moreover, there might be the robotic malfunction in the robots, though it is there, but it might cause the damage to the patient and it leads to the heavy blood loss. And the last disadvantage is that it is not a budget-friendly procedure because a single robotic system might cost around $2 million US, which is not budget-friendly and not everyone can afford. And also, not all the clinics and the medical care centers can afford this robotic systems because they are very expensive. So we would like to move towards the conclusion. So we would like to conclude. So telesurgery is the future of the healthcare. Even though it has so many disadvantages, but it has a vast potential to overcome its disadvantages. With the robotic surgery, in the future advancement, we can overcome its disadvantages and it can perform the greatest changes in the surgical field around the globe. Thank you.
Now I would like to call the Secretary of Student Scientific Board, Granny Nikita, with her research on transplantation on the miracle of 20th century medicine.
Good afternoon to everybody. My name is Nikita and my topic is the transplantation. First we have to know what is the meaning of transplantation. Transplantation is the process from taking from the donor and it is placed in the recipient. And there is two types of transplantation. Autografting and allografting. Autografting, it is the transplantation taken from the cells of the skin and it is is the autograph. And when we talk about the holograph, it is taking from the donor and placing into the recipient. That is another type of transplantation. And when we talk about the major allotransplantation or, excuse me, kidney transplantation, it was started by the scientists first between the identical twins.
This is a larger kidney transplant.
This is the visualization by doctor.
Every time you see a patient, we want to make sure it works for you. We want to make sure we can get you through the process, with all the complexities or unique things that are unique to you. We have wealth of experience with kidney transplant, and we will do everything possible to get you a kidney transplant. We did this for more than just the kidney that we get you. You're more than just the 100
The
kidneys.
doctor is explaining how the kidney transplantation is working.
A daughter,
Present days.
or brother, a school teacher, scientists, we're happy to get to you and wish you great work as well.
After the death of a person, 24 to 36 after we can transplant it to the donor. And next is the liver transplantation. First it is done in a 3-year child. And which was they are transplanting the liver. The 56-year-old person. And this is the lung transplantation is video when it is from the body and replaces where the tissue is damaged.